Welcome, beautiful souls. Before we begin, I want you to take a moment to create a space that feels calm, safe, and supportive for your body. This is your time. Turn off distractions, silence your phone, and give yourself permission to be fully here. Maybe you're near a window, feeling the sunlight, like I am, or outside, connecting with the earth beneath you. Let this be more than just an exercise. Let this be a moment of connection. The connection of your mind, your body, and nature. You will feel more of a pain relief when you incorporate your entire surroundings. Today, we are using a cork roller. I love using cork because it's a natural material. It comes from the earth. So there's something grounding and supportive about using tools that are aligned with nature. You might feel even more of a release when your body responds to nature. As you roll or hold your pose, I want you to feel that connection that you are fully supported. So today we are going to focus on the quads or the front of the thighs and the hip flexors. Okay. I am doing that today because these are some of the tightest, the most overused muscles in the body. Especially with our culture in our society, we do a lot of sitting, driving, and repetitive movement patterns. It is also paired with stress and anxiety when we're in that position. So when the quads and the hip flexors become tight, they don't just stay local. They can create tension and pull through the entire system of the body. And this can contribute to piriformis discomfort, so pain in the back of the hip. You can feel pain in the tailbone, pain in your SI joint, so the bony points back here, and even tension down through the groins, okay? So instead of chasing the pain, we're going to go to one of the sources, okay? Let's try to find the root cause of the pain. So let's start with our setup. We're going to come down onto our stomachs, okay? You're going to place the cork roller under one thigh, right at the top of your quads. Let's come right under your hip joint, just below your hip. Support your upper body with your forearms and your hands. Just kind of relax your shoulders and soften. Take a little deep breath. Good. Now you're going to start to slowly roll. So I would just want you to experience what it feels like. You're coming from the top of the hip all the way down to the top of the knee. And I want you to notice where the tension or the pain is. Move with intention. Move slowly. This is not about speed. Pause when you feel some tender or tight areas. And then you're going to hold and you're going to breathe into that space. Inhale. And as you exhale, allow your body to soften right on top of that roller and try to feel that muscle release and try to relax with that holding. As you roll and as you hold, bring your awareness to your body. So start to notice where in that leg, where do you hold your tension? Okay. Notice if your mind wants to rush or it wants to avoid the discomfort. And gently remind yourself that you are safe here. You are healing. You are creating space within your body. Inhale again. You can move like up or down an inch or two and try it again. If you want to try a deeper release, if you'd like it to go deeper inside your body, Slowly angle your body slightly inward toward your hip flexor. So you can start to roll the quad from side to side. So you're rolling across the fibers, okay? Small movements, slow breath. Let your body guide you. Okay? That's a little bit deeper, a little bit more intense, pulling across the fibers. Okay? Another way, once you're holding, you can slowly start to bring the heel up towards your hip joint. Very, very slowly. The slower you go, okay, the more you can control your nervous system and trying to keep it soft and safe. If you rush too fast, that's when your nervous system kind of gets scared, and then it'll start to build more tension up to try to protect you. Okay, so these are some of the movements you can do. Again, in the research, the holding, just hold on one spot for 30 seconds up to 5-10 minutes. Okay, that's one theory that works. The other theory is movements. Rocking across the fibers with slow, intentional breathing, or pulling your heel up toward your hip and coming back down. One other one is kind of like a zigzag, where it'll be a combination of your rocking back and forth and pulling your heel up towards your hip. Okay, so as I come back down, you're going to roll side to side and slowly pull your heel to your hip at the same time. Okay, when you've had enough of that, you can get off and switch sides. So when you get on the other side, notice if there's a difference from one side to the other side without any judgment, just awareness. Notice if one side's more painful than the other. I would work on the more painful side for a little bit longer than the one that's not so painful. Okay? So, final words, take a moment to pause. Notice how your body feels now compared to when you started. So I want you to start to notice these small shifts. Start to notice the feelings from one side to the other. Start to notice if you feel a little bit of relief after holding. By releasing the quads and hip flexors, you're helping to reduce the tension through your pelvis, your hips, and your entire movement system. This is how we create real change. Not forcing the body, but working with it. Can you do that for me? Try it out. Ask questions in the comments. Okay? Final message, your body is always communicating with you. The more you listen, the more you tune in, the more it will respond. Keep showing up for yourself. Keep connecting and continue to move with intention. Try this out. Try this releasing. Anywhere from 30 seconds to 2 minutes, 3 to 5 days a week. Come back and tell me how this feels. And if you're ready to go deeper into posture, movement, and connection, I'd love to support you. Send me a message and let's get helping your body today. Thank you for watching.